Hi, this is Dr. Rohrich. Welcome back to Rohrich Knows Podcast. We're going to talk about something that's not a filler, it's not a biostimulant, and we heard a lot about, filler fatigue, and I've talked about it in some of my podcasts. And is there an alternative to filler fatigue? And what are the alternatives? And we know that as we age, we lose a lot of fat in our face, the one place where you don't want to lose it. And how do you restore it? And can you do it naturally? Well, I think we may have an answer here. So I have a world famous and a leading dermatologist from New York City, Dr. Marmur, who is here with me today, and we're going to talk about Renuva. So Renuva is actually a matrix. Now, all of you have seen the movie The Matrix. It's a little bit more involved than The Matrix, but didn't you love The Matrix, Ellen?
I love them all, yes.
Yes, and of course we love Keanu Reeves. I mean, I think he lives in New York City, doesn't he?
We hang out all the time. We're going to grab some coffee later.
No, he's great. So tell us about Renuva and why is it so different? It's not a filler. It's not a stimulant. What is it?
I love this whole new field of regenerative medicine. I think it's so great. And I'm so surprised that many young people are on this. They find out what Renuva is. They come to my office just for Renuva. And I haven't really seen that with all the different treatments that we have. So it's really like a tissue matrix, right? You just said that, the word matrix. Yeah. That's the take home point. But extracellular matrix is if you were to look underneath the skin, it's that whole world of architecture of fat and the collagen around the fat and the blood vessels that come in the fat and how they all work together. So we're not just talking about one aspect, we're talking about kind of that whole world of fullness that is the fat plus its matrix. That's awesome. Yeah, it is. It's fascinating. So how do you get the adipose matrix? How do you... and obviously, it's a little more involved, but you have a very nice knack of explaining it very, very simply. And obviously, this is for our viewers. So if they're tired of getting fillers, and none of us like that overdone look, I mean, we see so much of that, and it really, I don't see so much of that in New York and some, a little more in Dallas, but a lot from Miami and LA, because people are just overfilled and overdone. And I think the big myth is that you can, it resorbs or that you can reverse it, and that's not necessarily true. And that's why I like the matrix. So tell us about how the matrix is formed and how do you get it? Yeah, well, I love a lot of your work, which is really pioneering in where all the fat compartments are of the face. It's so fascinating because you don't realize how much of a puzzle every little piece fits together so beautifully, and you have a deep and a superficial right. puzzle that this piece. So it's not just 2D; it's very three-dimensional, and knowing where those fat pads are and how they shift and atrophy or shrink over time is really helpful, because when we're outside of the skin and injecting this new fat matrix or extracellular matrix under the skin, we need to sort of visualize okay, where did Dr. Rohrich say that those fat pads were and where are they going away? So I feel I'm kind of a good example. I'm in my mid-50s. I really don't have any filler. My temples are shrinking in. I have big Irish cheeks that are now sort of high here, but sunken in here. All these things happen. You sit next to one of your teenagers and you're oh my God, my face is, shrinking, but also the bones shrink, the right. teeth shift inward. It's not just, the piriform aperture that opens as the nose falls in. All these things happen. But what we really want to do is restore that glow. I think one thing I love about Renuva is that you're not just restoring some extracellular matrix, or you're restoring some glow. And that's really that seventh dimension that we haven't been able to get from traditional fillers. So you asked a good question. I went a little bit around about to answer, but you asked how does it work? And I think one of the good metaphors really is this honeycomb matrix idea. Right. So if you visualize that honeycomb matrix that's totally empty, you're putting that in the skin, and then the neighboring fat cells are oh my God, that's so great. Let me go in there and kind of set up shop again. So just bees would come to an empty honeycomb and build a nice big hive and make some honey, that's what happens too. So we're putting the Renuva in, we're creating that little matrix, that new little house. and the neighboring fat cells can crawl in there and build this beautiful new fat pad.
Yep, that's beautiful, and that's exactly right. And basically, it really is kind of an empty house that's got a matrix, and the other fat cells come in there. And I like it because it's your own fat, and it looks more natural. Because when we see people, especially if they've had overdone fillers, it just is not a good look. And it doesn't animate when they talk, because we have so many muscles in our face, up to 52. And so that's why I like it. And I agree with you. People come to us because they say, I hear you do a matrix, fat matrix, Renuva. And there, it's actually such a different area, and it's a natural one. And I like things that are more natural, and you're stimulating, and not stimulating, but you're having your own body say, hey, I want to put fat where it was lost. And I injected, like you said, in the deep compartment, superficial, but I like putting it deep, and then you have to wait. Now tell us about the sequence. And it doesn't happen, you have to educate the patient. So what do you tell your patients about that?
Right. So is that you inject it, I dilute it down a little bit so that I find it.
I do too.
Okay, good. A little easier to inject. I mean, I think people should know that this is something that comes with a lot of gratitude, because it is a tissue donation process. So it really is a biological tissue that is from tissue donors, and it is, made antiseptic and clean, and it's safe to use, but it also is tissue. So you're injecting it. Sometimes if you don't dilute it down a little bit, it's, hard to push in there, right? So I like it to be able to stream it where I want it to go. Because I'm diluting it down, it is a little swollen at the beginning, but it's really not. I haven't noticed any increased bruising. I really haven't noticed any, pain afterwards. So it's a very comfortable experience. And I usually inject it to where I want it to look. I don't over inject knowing that it'll go down, right?
Right. That's all great advice. So you don't over inject Renuva, and it comes from this great company. It's a nonprofit. It's some MTF. It's actually in New Jersey. I like them because I went to visit them like 10 years ago, because I like them. They have great ethics. They really, really respect their donors and all those things that we like as physicians. In fact, their board are a bunch of physicians from Harvard and other universities. So I like that a lot. That means a lot to me, and I think it means a lot to you too. And I like that. That's rare in a company, don't you think?
It's lovely. And also they originally were using this in larger quantities for, after big burns or big,
right.
Right. It was used in bigger, it wasn't originally a cosmetic application. So we're kind of the last people, but they felt we're able to regenerate all kinds of things. Wouldn't it be nice if we helped it with some of the cosmetic things? So we're kind of using it as the finesse of Renuva, where it's been used in bigger places before that. That's nice and comforting too, because that it's safe. It has a track record of being safe. So the answer to your original question is, we inject it to look good, but we know that might not be enough. And so we normally have people come back sometimes 6 weeks later, sometimes a few months later. And I sort of try to say we might need to do about 2 or 3 sessions. Usually after 2 is when I've noticed that people are getting really happy. And then we know that fat itself can last up to 10 years. So, some of my patients, it has lasted for years and years. Some of them I still do every year, I'll be honest.
I agree.
Or we find other areas to do.
I agree. That's exactly my experience as well. And, everything in life, as we age, things, you atrophy, and even the newer fat that is in those areas, it will atrophy as well, but it does last a long time. And I like that. And it's natural. And and one of the things you mentioned is very important. You don't overdo it, don't overfill it. And because it's a matrix, and it's 2-3 sessions. That's exactly right. Usually by 2, you start seeing it. I usually have them come back. It's 8 weeks, and then by 8 to 12 weeks, I'll do another session if needed. And I think blending it is very important, which is like diluting it more. I know they have this, we help develop that. But basically, if you blend it even more, you can then put it into a smaller syringe. So
Yes, exactly.
that's good.
That's
And
we use a cannula for that. Yeah.
right. And I saw some of your results. They look spectacular on the face and the body and the
Yeah,
buttock
so we
area.
used it. I think it's really nice for people to hear. I use it on the chest for a lot of women who've had breast surgery for, either medically necessary or elective augmentation. So we'll use it sort of to soften the contouring of there, so it's safe to use there. Sometimes they have, this morning I saw a young 18-year-old who'd had major surgery on her leg and had a hip defect, so we can use it in
Oh
that
yeah.
area. We can use it anywhere on the face. We're not supposed to use it under the eyes or in the lips,
Right,
right?
right, and I think that's good advice. And I love it in the cheeks, in the malar area, in the lateral chin, and for the jawline. Temples, I sometimes use it. It's a little more discomfort there. I use it in a cannula, but yeah, it's fascinating, and I like it. It's like to like. I mean, you're trying to restore what's lost, and it's you're really stimulating your body to do that. I think. I actually think it's the next horizon. I mean, we've been with fillers, and they're good, the hyaluronic acid fillers, but there's a lot of things about them that I think that they're not totally biodegradable. We're seeing that. And then there's the biostimulants, and these are good. There's the Sculptra, which is actually an inflammatory response, and then there is Radius, which is calcium hydroxyapatite. It's also a biostimulant, and that's actually enhances neocollagenesis. But this is different. This is a matrix. This is a true off-the-shelf matrix, and so I think it's kind of like the third dimension, like you mentioned, right?
Love it. I actually did the original research on the biostimulation effects of calcium hydroxyapatite when I was in my fellowship on maternity leave. I would go to the electron microscopy unit and count collagen fibers.
Did you really?
Yes. And so I published that. I think it was 2003.
Yep.
Published the neocollagenesis effect of calcium hydroxyapatite. So I love that we're still in there. We're still respecting the biology of the skin and harnessing its power to do, like you said, like using the fat to make fat is the coolest thing. And then I think it's also important to know that it can still be finessed. So if people kind of stimulate too much and if they feel too full, which I haven't had happen, but it's nice for me to know that there's a bit of an antidote for it. So I think most people are using Kybella. Right. If they needed to. I haven't had to use that yet. Have you had any experience with it working?
No, I have not either. And
Okay.
and Kybella is deoxycholic acid, which is like it's a natural bile acid, and I've not used it in that. I mean, because I don't just like you, I don't overdo
so you
it.
haven't had it. Okay.
I'm not I don't do that. I don't do anything that doesn't look aesthetically good to me, even if the patient says I want these huge lips, or I don't do that. And I don't think you do either. You don't either.
Right. No, it's not going to be, not today. But, and I think so, like any listener who's looking for Renuva, if you do go to somebody who's injecting it, and if they say, oh yeah, we can use it under the eyes or in the lips, I would say, just say no, thank you, because that's where I'm saying we'd have to reverse it. If it grew too much, you'd end up with like blobs under the eyes, and that would not be a happy thing.
Right, and I think that brings up another thing, another important point. So, how do you find somebody? First of all, you have to find somebody that's a board-certified dermatologist or plastic surgeon that really understands, especially when you're talking about Renuva, a matrix, because that is a very specialized way of injecting it. So how do you find somebody that actually can do this? And I think you have to do your homework.
I do too. I always wonder when people say like, oh, I researched you and I found you. I'm like, really? How did you do that? I think like people might look up Renuva, find the company, and then look on the company website, right? I think especially with MTF, they're pretty careful about who they let do it. I know that, otherwise I would say look up at aad.org or the plastic surgery, which is the right way to look up the right plastic surgery.
It's, the plastic surgery, ASPS, or our aesthetic society. But even then, at least in plastic surgery, I would say there's a minority of plastic surgeons that actually have been taught to use Renuva to date. In dermatology, is it the same in dermatology?
Oh yeah, it's very selective, and I think that's great because it's a beautiful product. You don't really want it to get into the hands of anyone who's going to be a renegade.
Right, exactly right. Because I think you could do some harm, and just like with anything else,
Yeah.
the damage is always done proximal to the needle. That's the injector. So you got to be smart, and know before you go. I mean, we all see these horror stories done in spas and things. It just, it makes me sad.
Especially, yeah, and I think you're right. Especially now in New York, there's like every time I walk home, it seems like there's like a new injection spa. It's really different. It didn't used to be that way. So it is true. You have to be really careful about who's doing your injections. And even if they say, "Oh yeah, I've done this before," I don't know. Really? Like, have they? How do you know?
Right, I know. And I would just say for a consumer, especially when you're doing specialized things like a matrix like Renuva, I would just stay away from a spa. I'm just telling you, unless they really, really have done a lot of them. Because it's a really specialized way to do that. And even with injectables, because I see 1 or 2 a week of problems that have been done, just common sense things. And these are from good products, but done perhaps by the wrong injector.
Okay, I have a question for you. So I love doing. So a lot of my patients are over the age of 50, and not only does our face age, but the rest of our body ages. So there are other areas that we want to enhance, and so like butt enhancements, and even frontal enhancements. Like, so for the butt enhancement, I like the biostimulation using a combination
100%.
of things. Same. So, okay. So can you tell us what your approach is?
Well, I'll use a combination of Sculptra with Renuva. I think you get the matrix and then you can stimulate it. So I like using that. And in the buttock area, I do that. And I noticed that you do the same, right? You do it? You combine the two?
Yeah, and I think it's really, really nice. It's subtle. It's not that crazy like BBB.
Yeah, no.
BBL, let's call it for Brazilian, but it's not the HA look. So I do have patients who've actually gone to Brazil and I swear they've had like a gallon of HA put into their tush, men and women, and it can over time it's turned hard, right?
Right.
It's turned so hard, like it feels like you're knocking on like a coffee cup. And I've had to use hyaluronidase to reduce that, and it almost is gone. But I love the idea that we're stimulating the collagen and the fat using the Sculptra and the Renuva together, and it's really fun to make it sort of like a little higher up, a little rounded, but not,
huge. No, I agree. No, I think it's a good thing to use it, especially in volumizing areas like the buttock or in contour defects. I combine it all the time, and because you're doing the biostimulatory action with the matrix area. And I actually use Renuva sometimes in patients when I'm doing a facelift and they don't have enough fat. So I'll put Renuva in there and sometimes with fat, because it'll help bring the fat into that area because they don't have any fat in those compartments.
When you do fat transfer, do you always do nano fat or do you do straight fat?
I do both, because I use the way I do it, I use regular fat in the deep, because it's a bigger fat, and then I use micro fat in a superficial one. So I actually process it a little different. So it's in the deep layers, I put in the regular fat, and in the superficial layers, I put a smaller fat. But I think you with the matrix, you can put whatever you want in superficial or deep, because the body will actually recruit fat from that adjacent compartment. So yeah, it's fascinating. I think we're just scratching the surface here. So
I totally agree.
So in conclusion, tell us about some take-home points about Renuva that the consumer should know about this, and kind of knowing before they go. I think you've touched on some on how to select them.
Yeah, I think that fat is the new renaissance in our field. I think that fat is not just to look pretty. Fat is a super important organ. Or part of our face. It helps support the circulation. It helps support all the energy of the skin. It helps with moisturization. So fat looks good, but it also helps kind of tell everybody what to do. So the fat has been sort of like fat shaming, taking out your buccal fat, all that stuff. Like, we love fat for the face. So Renuva is a great alternative. So for those of people who don't do fat transfer or just need the convenience of something that's off the shelf, it's a nice extracellular matrix right off the shelf, the first of its kind. It's precious. It's important to have it done by the right people who have that artistic eye, who have the knowledge from your research about where the fat compartments really are. And then it does take a couple sessions, so just be patient. But I'd say I have like 100% patient satisfaction with Renuva.
Yep, I agree. I mean, fat is the best filler. I mean, fat is liquid gold. And Ellen, I'm so glad you said that. I mean, you know, you're talking like a plastic surgeon. I love that. So it's great.
Well, I think I'm a wannabe.
Oh, no, you're brilliant. And anyway, Ellen, Dr. Marmur from New York City, go see her. She's brilliant. And thanks again for joining us today. And please leave us your comments and questions. And this has been fascinating and highly educational. So remember, helping you become a better you. We'll see you next time. Ellen, thank you so much. That was awesome.